Hello, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Today we're going to go through some exercises and some stretches in order to be able to treat tennis elbow. Now, one of the things that needs to be said is that most often tennis elbow is being caused by problems in your shoulder and problems in your hands or your wrist. So if you are treating just the elbow, you're treating the symptoms, you're not treating the actual cause of the condition. So we're going to show you an exercise later that's going to focus on the shoulder, which is why I want to make this disclaimer before we go any further, because we want to make sure that as you're treating this on your own or supplementing a treatment at home, you want to make sure that you're focusing on the shoulder as well to minimize the overuse that is being caused at the elbow. Tennis elbow is just pain on the outside of the elbow. Generally, people will just speak about a point that's very tender, that they can touch and it hurts. Some people will talk about having pain right down here. Numbness and tingling is not associated with tennis elbow, so if you have that going on in your hands and fingers, it's probably something else, not necessarily tennis elbow, or it could be a combination of tennis elbow and something else. What you want to do is, the best thing for tennis elbow is strengthening the shoulder and doing these stretches and not using it as much if that's possible. Many people obviously get it in a dominant hand where they can't afford not to use it. But you want to make sure that when you're doing these exercises that there's not any pain associated with them. These should be pain-free. They may be uncomfortable. The stretches may cause a little bit of uncomfortableness. The massage portion may cause a little bit of uncomfortableness, but you don't want it to be excruciatingly painful. So the first stretch we're going to start with is you're going to just point your arm straight out in front of you. You're going to point your palm down, point your fingers towards the ground, and you're going to pull your fingers towards you. Now, for some of you who are very inflamed, you may not be able to pull your fingers backwards. Straightening your arm out and pointing your fingers down to the ground may be enough of an exercise for you. That's okay. Stop where you feel a stretch. If you feel that you can pull your fingers back, go ahead and do so. It's not a no pain, no gain situation. So you want to make sure that you gently pull, feel a stretch. You want to hold that 30 seconds, and you want to do 6 of those. This is a gentle exercise, so you can do this many times throughout the day. The next exercise we're going to show you how to do is actually a massage treatment. So what you want to do is you want to get your 2 fingers, okay, and you're going to put it, most people describe a point where it really hurts. You want to come down off that point a little bit because that point's actually bone, but if you come a little bit more off that point downward, and you take 2 fingers and you just gently go across, nice and easy, like you're strumming a guitar, okay? You want to press so that it's uncomfortable. You don't want to press so that it's excruciatingly painful. The more inflamed it is, you're not going to be able to press very hard, and you're just going to be rubbing back and forth, nice and easy over the area. As it gets better, you might really be able to put some pressure on there. You want to do this for about a minute. Don't do it too often because this can be irritating, especially if you're really pressing on there. So a minute, maybe 5 times a day, nice and easy. You're going to feel it sore, probably, but you shouldn't feel too much pain after that. Last exercise is the shoulder exercise that we're going to go into. And again, this should not be uncomfortable for your elbow. Should be totally felt in the shoulder. You want to go ahead and lay on your side. You want the side that's in pain up. So you want to lay on your good side, have your bad side up. You're going to keep your elbow next to your shoulder, next to your side, and you're just going to rotate your arm up and down nice and slow. You're going to hold this you want to lower this for about a count of 3, so you're not letting gravity do the work. You're going up and down nice and slow. If you get to 30 of these and you don't feel like you got a decent workout in, go ahead and add a soup can. Go ahead and add a weight, okay? Nice and easy. You want to do about 30 of these. When you're doing these, you don't want to throw your shoulder back. You don't want to move any other part of your body except your arm. Most problems that are caused at the elbow are actually from the shoulder due to a weakness in the rotator cuff, and this is one of the exercises that's going to help you strengthen that rotator cuff. If you have any questions, please give us a call at 215-997-9898 or visit us on the web at www.totalperformancept.com.